Introduction. Tinnitus refers to ringing or buzzing sounds present in one or both ears. The sound may be soft or loud, high or low-pitched, and continuous or intermittent. It can be very annoying and may occur in both children and adults. Children with long-standing tinnitus may consider the sounds normal and not be aware or even able to describe the problem. Causes. Tinnitus most commonly results from damage to the microscopic endings of the auditory or hearing nerve within the inner ear. Injury to these nerve endings can also lead to hearing loss. Tinnitus can also result from exposure to loud noises or conditions such as ear blockage, ear and sinus infections, Meniere's disease, allergies, high or low blood pressure, problems in the heart or blood vessels, tumors, thyroid abnormalities, or as a side effect of certain medicines or procedures to the spine. Signs and symptoms. A buzzing or ringing sound is heard in the ear, which can be continuous or intermittent, and vary in pitch and volume. Other symptoms may be present in case of an underlying condition. In Meniere's disease, an inner ear disorder, tinnitus is accompanied by severe hearing loss and dizziness. Diagnosis. Your doctor will review your medical history and perform a thorough physical examination to identify the cause of tinnitus. Additional tests, such as a complete hearing test or audiogram, may be performed. A spinal tap test may be required to evaluate fluid pressure within the skull and spinal cord. An MRI or CT scan may be needed to confirm a diagnosis. Treatment. Tinnitus may be managed by treating the underlying condition. You may receive treatment to remove earwax, treat a blood vessel condition, or alter medications that may be causing the tinnitus. Your doctor may recommend counseling to help you or your child understand and cope with the condition. Hearing aids may be needed to help correct any hearing loss. These devices control outside sounds and make it easier to hear. Other solutions include wearable sound generators, small electronic devices placed in the ear which mask the tinnitus sound with a more pleasant, softer sound. Tabletop sound generators which produce pleasant sounds such as waves, waterfalls, rain, or the sounds of a summer night can also be used to help you or your child relax and fall asleep. A new technique called acoustic neural stimulation is used to treat very loud ringing in the ear. It involves listening to music embedded with a broadband acoustic signal that desensitizes the brain to sound. A cochlear implant may also be recommended to manage tinnitus. It masks tinnitus by stimulating fibers of the auditory nerve. Certain medications for depression and anxiety may be prescribed to help you relax and get a better sleep. Summary. Although tinnitus can be bothersome, it is usually not serious. It may indicate an underlying condition, which if treated can reduce or eliminate the symptoms. Other treatments focus on masking the sound and making it more tolerable.